Hi everyone, this is Dr. Rufus Vasanth, Senior Consultant Orthopedic Surgeon, specialized in arthroscopy, trauma, joint replacement and sports medicine. Today I am going to discuss about a very beautiful topic. It's called as stem cell therapy in orthopedics. So what is stem cell therapy? We all know that stem cell therapy means regenerative medicine. So why we like stem cell therapy or regenerative medicine is because we all live in a world where we don't want to throw things, we want to repair it. So repairing is a beautiful thing, especially if it's involving your own body. So what I'm trying to say is that in medicine, there are multiple specialties. We have orthopedics, we have dermatology, we have different specialties. All these specialties are now focusing on something called as stem cell therapy. You might have seen a lot of reels, you might have heard about a lot of people having hand transplant surgeries, PRP injections into the head to increase their hair growth. So this is called as a stem cell therapy. In orthopedics, it's a beautiful thing used for specific indications. So what is a stem cell therapy? Stem cell therapy means we try to take your own body cells and we use the reparative and we use their specific power to regenerate the problems in your body. For what I am trying to say is that, for example, if somebody has got a problem in the knee, they've got an osteoarthritis, this stem cell therapy has got the capacity to go inside and regenerate it, reverse the process. So it sounds very beautiful, right? Because it's very easy to do a knee replacement surgery. We just take what God has given it, throw it off and put a new replacement. But if we can retain what God has given you. So that is a very beautiful thing in regenerative medicine. So when come to the stem cell therapy, the first thing what you need to understand is that what is a stem cell therapy? When I say stem cell therapy in orthopedics, as I said before, we need to take your own body cells, concentrate it and allow it to regenerate in your body again at a specific place where we want to happen. For example, it can be done from the blood. There are two common things which are done from the blood. One is called as a PRP, platelet-rich plasma. As you know, it's a very common topic and everybody speaks about it. So it's like you giving a normal blood test. You just come to the doctor's clinic, we ask you to give a blood. The blood contains around 20 to 30 ml of blood. Around 20 to 30 ml of blood is taken from your side. We put it in a centrifugation machine. This machine revolves and rotates and finally gives you a concentrated solution of PRP. So what is PRP? Platelet-rich plasma. So this is injected into your knee, shoulder, ligaments, wherever you have the problem. And this helps you to regenerate and reverse the process. This is one method. A little bit higher thing is that yes, we can take from your blood, but let's not stop just with centrifugation. We also incubate it for 4 hours. So you take it from your blood, we put it in a machine, we centrifuge it, and after centrifugation, we incubate it for almost 4 hours. So then it is called as autologous conditioned plasma or autologous conditioned regenerative serum. So this is then injected into your body to regenerate things. So this is considered a little bit superior to PRP because it contains more growth factors. As I said before, many people are very common with PRP. They all know about this only PRP, but there are much higher things than PRP. So this is from the blood. When sometimes we need that, okay, this is not enough, we need more regeneration, we need more growth factors, we need more stem cells, then we become a little bit invasive. So we can take it from your abdominal fat. It's called as an adipose tissue derived stem cells. Unfortunately, it requires a spinal anesthesia or some kind of anesthesia to do it. There are a lot of doctors do it with anesthesia also, but I would prefer to do it with anesthesia because the patient feels more comfortable. We take your fat cells from the abdomen. It's almost like a liposuction surgery. You take it out and then you centrifuge it and separate the growth factors and then you inject it into the part we wanted to. The highest form of stem cell therapy, what we call is called as a BMAC, bone marrow aspirate concentrate. So we put a small needle in your hip joint, that is in the pelvis and the ilium part specifically to be, and then we aspirate blood from there. So it's called as a bone marrow. This contains a maximum amount of growth factors. So as I said before, I have now told about 4 things. PRP, that is the basic variant from the blood. A little bit higher one is an autologous conditioned serum, that is also from the blood, but more concentration. And then the adipose tissue derived stem cells from the abdominal fat. And the last one is the bone marrow aspirate concentrate from the hip bone. So all these are called as stem cell therapies. Now what are we going to do with this? And what are the indications? Unfortunately, right now we live again in an era where everybody Googles about things and nowadays doctors and many people suggest stem cell therapy for everything, but you should not do it. You should be very careful for what are the correct indications because only then the results are good. Because stem cell therapy is a little bit expensive depending on which machines you use, where it's done and other factors. So when you take a stem cell therapy, one of the commonest approved problem all over the world is called as osteoarthritis, especially in your knee joint, ankle joints or any joint, but more in the knee joint. So what is an osteoarthritis? What is an osteoarthritis? Any moving joint in your body will have something called as a cartilage. because two bones can't move because they rub against each other, they'll cause friction. So to prevent friction, God has given you something called as a cartilage. That cartilage is between your joints. So this moves in a very, very smooth fashion. When this cartilage Vasanth has, it's literally like you're having a bike tire or a car tire. Because of age, because of time, or because of load, they can wear out. It is called as an osteoarthritis. So in osteoarthritis, we call it as stage 1, 2, 3, 4. Out of it, stage 1, 2 and 3 are clear indications for stem cell therapy. And there have been a lot of proven results, as well as a lot of studies, level 1, level 2 studies, which suggest that in early stage of arthritis, stem cell therapy works. We can try it with basic PRPs. If not possible, we can upgrade the level of stem cell therapy depending on what we need it. The other common indication is that people start using it for ligament injuries, partial ligament tears, meniscus tears and all those things. Even though the indication is not clearly described, there's nothing harm in trying it. But at the same time, you should be very clear that it doesn't work for complete tears. For example, somebody who's got a complete ACL ligament tear in the knee, stem cell therapies will never work. Partial tears have a high potential to heal. In such situations, giving stem cell therapies will allow it to fasten the process. If it heals, it will heal. If it doesn't heal, it never heals. That's what we need to understand. Similarly, in meniscus are nothing but shock absorbs in your knee. When the meniscus tear, you don't know when it tears and how it tears, but sometimes because of injuries, sometimes because of degeneration, it can tear. We call this signal changes in MRI. Grade 1 and grade 2 signal changes are actually not tears. In such situations, yes, stem cell therapies do work. In grade 3 meniscus tear, that's a complete tear, usually a surgical repair is preferable. So these are the two common indications where we commonly use stem cell therapies. Of course, yes, for any kind of tendinitis, a tennis elbow, that is a pain in the lateral epicondylitis of your elbow, or Achilles tendinitis, that is pain behind your ankle. All these places where you have pain, you don't have a proven tear, in such situations, stem cell therapies do really work. So we need to understand how to proceed in this. The first thing as a patient, what you need to understand is that stem cell therapies are not magical solutions. You need to know when it's useful, for which clear indications it's useful. Because sometimes I see patients come and ask stem cell therapy for everything. Usually I see a lot of patients in stage 4 arthritis where the knee is completely worn out, they can't walk, their legs are bent, they are walking with a severe bad waddling gait. In such situations, stem cell therapies won't work because the mechanical problem is there. Once your legs are bent, once the cartilage is completely worn out, when the joint is touching each other, that is, we call it as a bone-on-bone condition. In such situations, stem cell therapies won't work. You have to go for a proper surgical indications. So don't be always misguided or misleaded by saying that everything needs a stem cell therapy. No, stem cell therapy is a beautiful thing, but correct indications do work really wonder. This is one important thing which we want to communicate about stem cell therapy. The other things about stem cell therapy is that let the doctor always decide about when it's a correct indication, how many doses of injections to go. For example, when we give a stem cell therapy in the knee, there are many companies which actually recommend minimum 3 doses with a gap of 7 to 10 days. But some companies which have higher concentration will recommend only 1 dose. So sometimes patients read about it and they get confused. They say some doctors said 1 dose, some doctors said 3 doses. But I think you should give it to the doctors because they know what is best for the patient. And as a patient, you need to trust the doctor because that's how it goes forward. Similarly, the common things which I would like to discuss is that stem cell therapy or the regenerative medicine is a beautiful specialty. It's an upcoming specialty. It's only for the last few years. A lot of senior doctors don't believe in this because it's more a recent technology. Some people feel that it's more of a humbug, it doesn't work. But in my hands, we have always realized that many times it works pretty well. Of course, yes, for some patients it doesn't work. There can be multifactorial reason for it. So when we give stem cell therapies, we never give 100% success rate or we never give 100% warranties or guarantees. But the one good thing about stem cell therapy is that it's harmless. We just take your own blood or we take your own tissues and it's just centrifuged and given back to your body. So we're not injecting anything abnormal because there was a long time where the only kind of injection which was available in the market was steroids. If you look at steroids, everybody knows that steroids got plus and minus. Steroids are a beautiful one. For example, in the knee, my only indication is that somebody coming with an acute exacerbation of OA. So what it means is that somebody who's got suddenly severe pain in the knee, I would like to give 1 dose of steroid because it goes inside, reduces the inflammation, reduces the pain. The patient feels really comfortable. But again, steroids cannot be misused. More than 1 injection within 6 months has got a high chance of infections and complications in the knee. So there was an era where many doctors believed and many patients believed that the only solution for pains was injection, and that injection was steroid. If you ask, many patients will say that I used to go, the doctor will give an injection in the knee, then I'll feel happy for some time. Then I'll go, he'll give an injection, I'll feel happy for some time. And steroids are very cost effective, they're very cheap also. But that's not the right way to go forward. Stem cell therapy is a new era of injections where they give you a better solution, more natural solution, and they don't harm you. Because stem cell therapy can be repeated many times and they have no side effects. Of course, yes, we nowadays have something else called as a lubricant. It's called as a hyaluronic acid. So what it means is that any joint will have a normal lubricant because it has to move smoothly and freely. So that lubricant is called as a hyaluronic acid. So sometimes as you age, when arthritis set in, the hyaluronic acid content comes down. In such situations, we artificially inject it. It is available in the market. Hyaluronic acid are much superior to steroids because they were the initial replacers of steroids. When there was an era when only steroids were used, hyaluronic acid came and many doctors started using it. Many patients started feeling better because they go inside, they don't harm you, they just lubricate the joint. And nowadays, the current indication is that a stem cell therapy combined with a lubrication is the best thing for osteoarthritis in the knee joint. Of course, yes, if it's not arthritis, then hyaluronic acid role is very minimal, which is generally for arthritic related conditions. The other conditions is more of a stem cell therapy. It's more of a stem cell therapy where you give PRPs, ACS, adipose tissue-derived stem cells or a BMAC for different indications. And also one of the common indications and other things which we see is that there's something called as a avascular necrosis of the hip. So the hip joint is a ball and socket joint. The ball sometimes can get decayed because it loses the blood supply. It's called as an avascular necrosis. I recently also did surgeries for many patients post-COVID era because during COVID, many patients took steroids and many patients take steroids for multiple health issues. We can't say it's wrong. Sometimes you need steroids because steroids can be life-saving drugs. Sometimes steroids can be used for very severe conditions. The problem with steroids is that sometimes they also reduce your blood supply to the hip. So that develops a condition called as avascular necrosis. In such situations, core decompression, that is you decompress the core, allow the blood flow to go inside, and then injecting a BMAC is a well-proven technique because that is something which is natural, because if you don't treat it in the early stage of avascular necrosis, up to stage 2B, you can actually beautifully treat it with core decompression and BMAC. But later stages, stem cell therapies won't work. You need to do a hip replacements and other kinds of invasive technologies. The problem with hip replacement is that, and the problem with AVN is that most of the times AVN, that is avascular necrosis of the hip, happens in younger people. So in younger people, if you do a hip replacement, you have to understand and also take it with a pinch of salt that they might need multiple surgeries in future. So as a whole, what I'm trying to say is that stem cell therapy or regenerative medicine is a beautiful specialty which is now available everywhere. The specific doctors trained like me who specifically use it for perfect conditions. So be very clear that stem cell therapy cannot be used for all problems. It is used for specific conditions. In that specific conditions, yes, they work really well. There are no guarantees or warranties in stem cell therapies, but they really work well. So it's a beautiful medical field. So I hope you enjoyed about the stem cell therapy and its uses and how to go forward. We'll meet again with some other interesting topic. Thank you.